Okay, welcome to Pelvic Floor Month. I am chatting with Jennifer Yellin-Snyder. Jennifer, do you want to just tell us a bit about what you do, and then we'll move on to the topic?
Absolutely. Thank you, Emily. I am so happy to be here and talking about our bodies and as women especially. And I am a movement specialist as well as an online health coach. I specialize in helping women feel more empowered and capable in their body through the systems of Pilates, yoga, and eccentrics. And I love movement. I've been dancing since I was a child. So it's natural, it comes naturally to me. But what I love about these systems that I teach is that it doesn't just work with the movement from our muscles and bones that we see in our mirror every day, but it also works with all of the deep muscles that are really responsible for stability and power in our movement.
Awesome. So, of course, I say of course, to me it's of course, because I've done a lot of Pilates classes over the years, but pelvic floor ties in so much with Pilates, doesn't it?
It absolutely does. So when we teach new clients, I start with biomechanical principles that can be used in any type of movement, especially within stop Pilates, which is a more modern version of Pilates, which I teach. So if I tell my clients, if you can master these principles, you can do any movement safely with more stability and more ease and more fluidity. So to talk about the pelvic floor, we have to go back to the first biomechanical principle, which is breathing. And of course, breathing, you have to breathe to have life. And a lot of people think, well, why do I have to learn how to breathe? I'm alive, right? But we actually can learn to breathe more efficiently, especially in our hectic everyday lives, where when we're rushing or under stress, I mean, come on, the last 2 years has put us all on that level playing field, but it's been there for a long time. But when we are rushing or under stress, we tend to breathe more short and shallow. And that keeps the breath in our upper lobes of our lungs. And so we're trying to teach our clients how to breathe three-dimensionally, but also how, when you use your core stabilizers with that three-dimensional breathing, you actually have more power and stability. And so a lot of people come to us with back pain or feeling unstable, balance is off. And even women in perimenopause and menopause who have pelvic floor dysfunction. And so part of what we teach them before we even tell them about the pelvic floor is that three-dimensional breathing. So we're trying to get the breath from the upper lobe to also distribute to the side and the back of the lungs. And that happens because the diaphragm, which is attached to the bottom of the lungs, think of like a little dome. It pulls down as we inhale and it pushes up and pushes out the air as we exhale, like an umbrella that's closing and opening. And the pelvic floor is doing the same action as our diaphragm. It's just, in a smaller version. And so our pelvic floor is pulling down on the abdominal cavity, and that pulls it down along with the diaphragm. And as we exhale, it pushes it up and open. So the lungs are getting pushed up against, and the abdominal cavity is getting pushed up against from that pelvic floor. And then along with muscles in the spine, think of a zipper going down your back. They're called multifidus. So together with the diaphragm, the pelvic floor, moving that abdominal cavity muscle called the transversus abdominis, and then zipping up, that's what creates that inner tube or that hug around the spine. So without breathing properly, we're not using our core muscles properly, and therefore we're not using our pelvic floor muscles properly. So we teach that concept, and people's minds are blown because they have no idea how important breathing is to the internal functions of their body. So that's one aspect of how we get across the importance of pelvic floor in Pilates. And, you know, in Pilates and yoga and any other type of movement that requires us to flex or turn or side bend our body, we want to come from a place of stability first and then movement. So in order to do that, you want to get that breathing and pelvic floor combination working. And so then we start conditioning our bodies through these practices. And so when we go to lift something heavy, like our grandchildren or a piece of luggage, and we don't have that oops moment when our bladder starts to leak, and when we sneeze, all those deep core muscles start to kick in. And that's the point of conditioning, is that they're there for our use, not just to make our stomachs look better, although that's a nice side benefit, but they're there for our functional everyday use.
And I think you've absolutely hit the nail on the head there, that a lot of people we get caught up in this idea that our core muscles are for us to have a flat stomach or for us to have a six pack or any of those things, when actually that's kind of irrelevant. That's not what they're there for. They're there to support the whole torso, aren't they?
Absolutely. It really comes down to our bodies functioning better. And now that we know why it's important, it's helpful to know how it works and what we're going to do to make it work. So first, we want to just take longer, deeper breaths. And we want to inhale through the nose and blow out through the mouth, at least when we're doing these type of physical exercises like Pilates. I'm not saying this is the one and only breath. In yoga, we use something called Ujjayi breath, which is more of a contraction at the back of the throat. It's going to do the same thing. But to get that nice deep breathing, get away from that short, shallow breathing. Then also, we want to make sure that we're not over efforting. So when we're conditioning, our exercise is a balance between muscles that stabilize us, muscles that move us, and then the muscles in between that do both functions. And so our deep core muscles are just about stabilizing. And so when you're conditioning and you're doing a full body workout, let's say that lasts, whether it's 20 minutes or 60 minutes, we need those muscles to stay turned on like a light for the duration. And so if you are contracting your muscles to 100%, just imagine holding your face in like a squeezed prune face for 20 minutes. It would get exhausted. It would maybe even, get stuck. Our mothers used to, my mother used to say, don't wear that frown, it's going to get stuck on your face. So our muscles actually become tonic, where it's almost like a cramp. So our pelvic floor muscles, along with some of those other core muscles I mentioned, we're lifting and releasing, but we're doing that with a holding that's about 20%. So imagine that you're on an elevator up 10 floors. About the second floor, you have that lift of the elevator, that's where it stops. And that's as much effort as you need. It's called submaximal effort, 20 to 30%. So when you're engaging, don't engage to 100%, just engage submaximally. So sometimes we come across people who say engaging the pelvic floor is like Kegel exercises that people might have done when they had children or when they started to experience perimenopause, because our estrogen levels change. So it's going to change how our muscles react. So you can actually be like myself. I have not had the privilege of having a full-term pregnancy, but I still have pelvic floor dysfunction if I'm not careful. And that could come with the different hormones in our body. So I've trained my muscles not to engage to that nth degree and have trained them submaximally. along with some pelvic floor physical therapy, I'm now able to have better function. I don't have those surprise moments when I sneeze or when I'm doing jumping or something to that effect.
I think
so it is very important.
But I think you've hit the nail on the head there, that there's an assumption. There are two assumptions. One is that it's only affects women who have given birth, which isn't true. And
Correct.
the other assumption is that once you have a problem with your pelvic floor, that's it. You've just got to buy the tenor lady pads or whatever and be done with it. And again, not true.
Absolutely. I mean, I don't do the internal manipulation like a physical therapist would, but they teach you how to do it for yourself, or there's actually equipment you could buy on Amazon. Who knew, right? That helps you train your, re-energize your muscles so that you're taking the stiffness out of it and they become more pliable. But also then once you've done that, you want to keep those muscles in good shape. So learning these proper biomechanical principles through Pilates and yoga and through other conditions, conditioning, you can actually help yourself then keep that pelvic floor healthy and functional. And if every now and again you slip up and you're losing your routine and you've gone back to being a little more tonic or a little less responsive in the pelvic floor, good news, you could bring it back to life.
Yeah. And I guess, ultimately it's a muscle, isn't it? It's like if you get, you train for a run, your leg muscles get stronger. And then if you stop, then they get weaker again. And the same, it's only the same in that respect. It's just knowing what the right exercises are to do to help.
Absolutely. And there are actually layers of muscle. So imagine a bowl and you've maybe put strips of muscle all around the bowl. That would be how the pelvic floor looks in a rough image. And then it acts like a sling for our internal muscles. And, a lot of women who have prolapse might have some pelvic floor dysfunction. So basically it holds that uterus and the other internal organs in place. And a lot of women who have cramps or pain in their pelvis around menopause, they think, oh, it's perimenopause and, there's nothing I could do about it. And it's just another reason why I hate this phase. A lot of times it could be due to one of those layers being in dysfunction. And so, it is a muscle that does need to be trained. And then the proper way of training it is in its full length. So you don't just want to grip it and make it like static. Just imagine like you stuck your finger in a light switch and your hair kind of buzzed out to here and you're electrocuted. I mean, that would be an example of a static, still but energetic response. We don't want that. We want our pelvic floor to move like our breath, expand and contract. And that's healthy movement. And so you get that balance of contractions. That's a healthy muscle right there. And so part of what I do is training that deep layer, and people have more control, more power. And I think one of the biggest compliments that I get from my clients when they learn that for themselves is that, wow, I thought I wanted to be skinny, but I really want to be powerful and capable. And all I'm doing is teaching them how to utilize the body that they were given. I say, I didn't design the body, I just help you make it work better.
And that's perfect. Thank you so much, Jennifer.
My pleasure. Have a wonderful day.